This program is rated PG. It contains themes and scenes which may not be suitable for very young audiences. Parental guidance is advised.
Be advised that the views and opinions of the hosts and guests do not reflect those of the station.
Physical therapy is a tool in the healthcare field utilized to find impairments and disabilities in the individual.
Through physical therapy, we can evaluate and find out what's causing a lot of these impairments. It's our job to figure out how to correct it.
Physical therapy encompasses various tools such as functional movement screens, corrective movement patterns, and actual range of motion, strength, and flexibility assessments.
Physical therapy usually involves some sort of manual treatment techniques, whether it's soft tissue mobilizations or joint mobilizations or trigger point releases or any other kind of manual technique. And that's usually paired with some sort of corrective exercise,
which as an overall outcome will improve their functional activities of daily living.
Corrections in the body that's going to then carry over and have the patient move the right way.
Throughout the years, the misconception of physical therapy under the supervision of a doctor is that it is just a manipulated wellness exercise program where they could do it at home. What the truth is that true physical therapy should be a course of hands-on manipulations, range of motion, and will be based on treatment plan.
The first thing that they should expect is to learn a lot about their body and how they're moving and why their problems are occurring. Sometimes people are surprised by what it really is that's causing their pain. Good physical therapy should stress how to make changes in the person's life so that these problems not only go away right now, but they go away forever.
We're not just putting a hot pack on them, setting them up for 15, 20 minutes, putting them on an arm.
Welcome to Philippines Uncut. I'm your host, Buddy Kunanan. Now, in this show, we talk about everything under the sun. And tonight is one's about health, specifically a medical discipline that helps people with physical disabilities and movement dysfunction. And the examples of these are stroke victims, injured athletes, people dealing with chronic pain, and people who've been involved in accidents. Now, joining me to talk about this very interesting topic is Dr. Ronald Samaniego, and he's Doctor of Physical Therapy. Dr. Ron, welcome to Philippines Uncut.
Thank you. Thanks for having me here.
And a pleasure to have you, actually, Doc, because, PT, physical therapy, or PT, our show today entitled Moving Forward with PT, is, it's a field we all know about, we all hear about, but which most people are not really crystal clear about what a PT's work is and how it complements that in that of other medical fields, no?
Yeah.
So let's talk about first your background. Tell us a bit about who is Dr. Ronald Samaniego.
Well, I graduated here with my bachelor's, yung undergrad ko, and then I continued sa States na, so Utica College in New York. In the States, kasi you finish a bachelor's first, and then you go into a doctorate degree. It's another 3 years post-grad.
Okay.
Unfortunately, here in the Philippines, I don't think we have it yet.
Okay.
So I noticed 3 years ago that the stuff that we've been doing here in the Philippines is still the same. Unfortunately, so I said, hey, you know what? Let me go back. So I went back 2015 just to check out the place. I went back April. That was the time then yung son ko had a circumcision. And apparently we don't have any privacy issues yet. So the nurse called my son, no?
Yeah.
Ron Allen, it's time for your tule. so instead of getting mad, I stood up and I said, hey, I'm Ron Allen, it's time for my tule. So everyone laughed, right? So I didn't know that the surgeon was laughing inside. And then we were talking and said, hey man, you know what? I think we need to talk. So we had dinner and I told him what I'm doing sa States. Sabi niya, wala pa nito dito.
Interesting stuff. I mean, so here, you said in the States it's a bachelor's, no? So they finish this 4-year course, and then you are a physical therapist, right?
Here in the Philippines.
In the Philippines.
5-year course.
5-year course. In the States?
In the States, they finish a 4 or 5 year degree, and
Yeah.
then they go into postgrad.
Which is what you did.
Yeah.
And so you have a doctorate in physical therapy. From which institution in the States?
Utica College in New York.
Yes. And in the Philippines, are there many people like you who are actually doctors of physical therapy?
Right now, that I know of, I'm the only one.
How come? I mean, I know that here in the Philippines, we have a lot of physical therapists. In fact, we export a lot of them overseas.
Yeah,
You know?
yeah.
And it's a reason. It's one of the main reasons why a lot of people take physical therapy, because of the promise of a lucrative career overseas. No?
Yeah.
Which we'll talk about later. But why is that? How come we don't have any, or we don't have many doctors of physical therapy?
I feel that siguro dahil walang gusto umuwi, no?
Okay.
I mean, if they're doing good
No, no,
in the
for
States,
sure.
right?
Yeah, yeah.
If they're making like 6-8 grand a month in
Dollars.
dollars, right? So why would they come home?
Yeah.
So ako naman kasi I feel that I'm being beckoned to come home. Parang, hey, you need to go home.
Yeah.
So after no experience ko nun, I came back. So that was April. Parang ginawa ko Divisoria ng Amerika. Bumalik ulit ako ng May. I checked out different places kung saan nila, where they render physical therapy, and I found out that they're still doing the same things.
Yeah. Now, in this doctorate, what else do you study? Because I was always under the impression that when you finish this 4 or 5 year course in physical therapy, that's it. You're a physical therapist. You can do the work, and that's it. It's as simple as that. What do you take up in your extra 3 years of PhD?
Well, it's more of a, it's not a PhD, but it's more of a DPT, so Doctor of
Okay.
Physical Therapy.
Yeah.
So you learn about the laws, you learn what else you could do. You learn more about diagnostic evaluation or differential diagnosis, X-rays, MRIs, and a lot more about what PTs could do. Kasi oftentimes when we graduate, so bachelors,
Yeah.
parang ito na lang ba? Is this it? And then
Okay.
basically the DPT opens your mind into the possibilities. Ano pa bang meron?
So those are the fields you talked about, diagnostics and then X-rays and all that. Don't you take that up in your bachelor's?
No, we don't.
Really?
We don't have it here in
Okay.
the Philippines.
Oh, so you're actually very dependent in that case on the doctor that you have to work with, no?
It's in the Philippines, yes.
On your MD
Yeah, on
that
the
you work
MD.
with. But with this doctorate now, it probably gives you more
Autonomy.
more skills, more
Yeah.
knowledge, more arms really
Yeah.
in your profession, no?
Yeah. So you're not really dependent on a medical doctor. Because I feel na in the field of physical therapy, we are the experts. So why do you have to ask the doctor what to do when you're the expert?
Why do you say that? Okay, why do you say that you guys are the experts? Because traditionally when you talk about PT or physical therapy, it's kind of like a, excuse me for saying, but kind of like a minor, like an adjunct, like a
Yeah.
complementary treatment to the main,
To the main.
to that the service being provided by an MD, right? So why is that? I mean, when you say that you guys are the experts.
Well, we went to school for it, passed
Okay.
the boards. In fact, according to the census, it's the number 3 hardest board exams. I think in the world or in the
Really?
Philippines, yeah. There's a really hard board exam with
I didn't know that.
yeah, mataas ang mortality rate niya. And for a PT to listen to let's say an example lang naman, we're not trying to hate on anyone.
Sure.
Listen to a doctor who says, okay, I want you to hot pack, ultrasound, or whatever. I'm like, man, you know what you're doing, right? Why do you need to do that?
Question. Okay, what do you guys do, or what do you guys know, or what skills do you guys have that the doctor, that MD doesn't know? Because I was always under the impression, because the traditional thought is like, at least for lay people like me, like PT is just another like a complementary treatment. I always thought that the doctors know more, and that you guys are just doing that helping people with recovery and movement and that kind of thing. What expertise do you guys have that MDs don't have?
Like I said, we do differential diagnosis now. We do orthopedic testing because oftentimes when you go to a typical doctor,
Yeah.
Okay, buddy, I'm gonna have you get an X-ray, get an MRI, blood work na to, just in case for your gout, right? So it's really expensive, right? Really expensive.
I don't have gout, by the way.
Oh yeah, of course. Yeah, that's an example.
Okay, yeah. Continue.
Yeah, so
People might get an impression.
Yeah,
here.
right. No, he doesn't have gout.
Good.
All right.
Continue.
Right,
please.
there we go. So what happens was, you do all that stuff, and sasabihin ng doctor mo, yeah, you got knee pain, right? Caused by arthritis. I'm like, yeah, I already know that. Why did you make me spend all of that
Oh
money?
yeah, I
right?
mean, that's precisely why you went to the doctor.
Right?
Because you have pain.
Yeah, right.
Okay.
But I already know that, but they're saying the same things. I'm not saying all doctors do that, but mostly that's the experience, right?
Yeah.
So
It's by the numbers, as
By
you
the
said,
number,
no?
right?
Testing, and then as you said, X-ray, MRI, and things like that, no? Blood work and
Yeah. In physical therapy now, especially in the States, we do musculoskeletal testing. Meron kami special test na tinatawag na parang orthopedic testing. Ginagawa ng mga ortho din sometimes to know meron ka bang ACL problem, meron ka bang ligament, meron ka bang bone problem, without resorting to an MRI or X-ray.
Interesting, interesting. So what you're saying is that if people watching now, for instance, have pain, let's say they have shoulder pain or joint pain, and they can actually go to you guys straight.
Yeah, yeah.
And not because, you know, again, the knee-jerk reaction would be, you know, I got a painful knee, a painful shoulder, I'll go to the hospital, I'll go see a doctor. You know? But what you're saying is that you guys in your field actually are better equipped to deal with these types of cases.
If it's musculoskeletal, yes.
Interesting,
Yeah.
interesting.
Yeah, so
No, this is a complete eye-opener for me because, you know, again, as a layperson, our mentality is go see the MD, go to the doctor, go to the ER, whatever, no, go see an MD.
well, back when I was a new grad, no, sa PT dito sa Philippines, I had this shoulder pain because I was sleeping in my sofa. Kasi nung time na yun, I don't want to sleep in the bed. Gusto ko sa sofa. Kasi telebabad eh. Nung time na yun, di ba, bata pa ako. What happened was, asakit the shoulder ko. It's been nagging to the point that I could not sleep. So I went, knee-jerk reaction, go to a medical doctor from in a hospital. And sabi ng doctor, X-ray natin. Sabi ko, sige, X-ray. Pag X-ray, sabi niya, sige, balik ka uli. Sabihin ko sa yung result ng X-ray. Ba't di pa ngayon? Hindi, basta balik ka. So, balik naman ako. Pagbalik ko, sabi niya, wala mo nakita eh. So, ano gagawin, Doc? Basta inom ka lang ng alaksan. Okay. So, I was thinking back, looking back now, I wish someone like me came home.
Yeah.
And I saw someone like me in the newspaper, or sana may Facebook na nun. And I saw someone who could treat it.
What would you do if someone like that, if you your younger self could go to someone like you? What would someone like you? How would someone like you have diagnosed it, treated it?
I would have looked at the movement dysfunction, sa ba talaga nanggagaling yun?
Yeah.
Kasi oftentimes, if it's not within the joints, it's in the muscles. So I'm going to check all of that, no? And then, of course, definitely I'm going to correct it. Kagaya sinabi kanina, we don't want to just patch it up. We want to correct it.
How interesting.
Diba? So talagang pagpasok ng tao, okay, yeah, I'm going to treat you today. Ito yung gagawin natin. Paglabas nila, may results na sila.
Yeah. Now in the Philippines, okay, fine. You're a doctor of physical therapy. In the Philippines, are there? I mean, let's say diagnosis. Your ability to diagnose patients and to find exactly what's going on, what's wrong with their bones and their joint, etc., etc. It's because you have a doctorate in physical therapy, or can any physical therapist do this?
Here in the Philippines, yes, it's in the scope of practice. They can do it. They can do it. Unfortunately, they're not really trained to do it. I feel
Because they have to rely on parang they take the cue from the MD.
yeah, they have crutches, but in loob, mga MDs. Parang okay, kung ano sabi ni Doc, yun na lang. Diba? Which is to us, kung galing sa America, that's not wrong. You should be able to you should be able to diagnose it on your own.
Sure. I mean, this is a complete paradigm shift for people in your field here in the Philippines.
Yeah.
And even, I told you, even lay people like me, what an eye-opener. I have a good friend, his name is Vince Alimurong. I'm going to forward this to Vince. He's also a PT. And yeah, I mean, really big eye-opener, big eye-opener. So today in the Philippines, this situation is what is happening. As you mentioned, I mean, PTs are here, and they help people with as I said, physical disabilities, movement dysfunction, but they don't do diagnosis.
They don't. They will do their evaluation. I guess in some hospitals, I heard, like UPPGH, they were able to do that. But mostly they could not.
Why is it in America, the States? Why is it like that? How come how come PTs are so empowered in the States as compared to dito sa Pilipinas? Sabi mo nga, parang sidekick lang sila ng doktor. Be frank about it, no?
Yeah. I guess there's vision sa America. There's what we call Vision 2020. In 2020, year 2020, all physical therapists will be doctors of physical therapy.
Wow. That's the aim, huh?
That's the goal, and it's happening now. Sa Philippines, we don't have that.
Well, I mean, yes, you said you're the only one you know of who's a doctor of physical therapy, right here in GNN.
Yeah.
In the whole country of 100 million people, only one doctor of
now
physical therapy.
that I know of who's practicing.
Yeah. Unreal.
Yeah, unfortunately, walang gusto umuwi. Ako personally, I just like to stay here. Gusto ko dito na eh.
Yeah.
Nakita ko, I have this skill, I have this knowledge base that I want to take home. Why would I use it there when people need me here?
I understand that you have opened a series of clinics, which we'll discuss further later on in the program. But quickly, what is this branch of clinics about?
Nag-start ako sa show.
Oh.
I started show, 30 square meter space. After about a couple months, we had 40 to 50 people a day na seeing us. And
40 to 50 people a day after a month.
After a couple of months.
After a couple of months of operating, ang dami ng kagad ka, no?
May blockbuster na kami sa, may box office na kami doon sa gilid. So we had to put chairs outside and everyone's complaining, traffic is bad. But I'm like, it's only 3 miles away to Makati. Why? Anong problema ng traffic? I didn't know kasi nasa condo lang ako. Nandun lang ako.
Did you drive? Did you try driving?
Yeah, yeah. Terrible. So 3 months away lang. Pero nakita ko nung nag-drive na ako, lumabas ako, talaga palang masama, ano?
Yeah.
Talaga palang kahit 3 miles away lang, abot ng ilang oras.
Pero, I mean, 40, 50 people within a couple of months. What were the ano yung major complaints niya? Ano yung kadalasang kapansanan nila?
Mostly yung shoulder sa knee issue nila. We get low back pain every now and then, pero mostly yung shoulder, frozen shoulder sa knee issues.
So you're saying is dito sa Pilipinas, ayan talaga yung, if there's one motion dysfunction illness, I mean the major ones, it's either shoulder or knee.
Ngayon, I don't know if I'm marketing for it, but the thing is I'm marketing for all of it, right?
Yeah.
Pero ang mostly pupunta may mga shoulder problem, knee problem. Kasi sabi na pag may problem ka sa shoulder, you can't sleep.
Absolutely. Very hard to do anything, no?
Yeah.
Very hard to drive, very hard to just even do basic work, no?
Yeah.
Same with the knee.
Same with the knee.
Diba? Kung you have a knee problem, then
How can you go up the stairs?
just even walking from here to there is a pain.
Not
no?
gonna happen, no?
Yeah. Why is it? How come we seem to? I mean, is that normal for there to be so many patients with these problems? I mean, what's causing it?
Sa shoulder, clinically, nakikita ko, nangyayari, they sleep so much on that side, right? I mean, if you put let's say I'm upright right now, and I put my neck on this side, and I do that for the whole night. Man, 5 minutes mo na lang gawin niya, and then unatin mo, masakit na, di ba?
Yeah.
How much more if you do it the whole night? So, of course, it will generate a chain reaction down the shoulder, where a lot of muscles passes, and then maglalak na yung shoulder. That's why they call it adhesive capsulitis, eh. Adhesive, dumikit, parang mighty band. Capsulitis, namaga. The whole capsule, namaga.
Yeah.
So, the next day, wala na.
What about the knee? How does the knee get busted?
For different reasons. I guess running, jumping, ACL injuries, yung mga ligament injuries. So it could happen for different reasons. Pero most of the time, may mga knee pain. Sabi na, may arthritis ako eh. I have knee pain. It doesn't matter if you have arthritis. To me, arthritis is a result of what's going on inside the joint. Ngayon, kung talagang severe na arthritis, you can't fix it, then they have to go to a surgeon to do a total knee replacement. Ano?
Yeah. Wow.
Pero kung hindi pa naman ganun ka-severe, we could fix it para hindi siya mag-cause ng friction sa loob.
Really? Just by, I mean, non-invasive and
Non-invasive, non-surgical.
Ah.
And usually, our patients see the results on the first visit pati.
Yeah. What about gout? Okay, since you brought up the topic of gout, gout is a major pain for some of my friends, okay, and people I know.
Gout, I see it, parang allergy ang gout, di ba?
Oo.
Let's say pag kumain ka ng maalat and all that stuff, all of a sudden it flares up, di ba? Then stop eating it. Di ba? Yun ang sinasabi ko. Kasi the thing is, wala man talaga siyang real cure, ang gout. We can manage it kasi it's inflamed.
True.
But the best management is to avoid it. Yung mga
Yeah.
pagkain na nagkakos nun eh.
Or those with high in foods, high in uric acid, no? Things like that.
So might as well avoid it.
But what you guys can do is you can help them, say, make it bearable for them.
Make it bearable, make
yeah.
it tolerable, mas komportable sila pag nag-flare up yung gout nila.
Yeah.
Kasi mayroon mga tao nag-iingat talaga pero nag-flare up pa rin eh.
Because it's of genetic or
It's
mga
a systemic problem
hereditary problems, no? Predisposed already to things like that.
Yeah. So, just have to avoid eating those food.
And then your office is, because where are you based, Doc?
Right now, I'm based in Shaw,
Yeah.
Mandaluyong.
And how many branches do you have?
We're magte-10 na.
Wow.
Yeah.
When did you start with your first branch? Yeah, pero just recently, no? I mean, fairly recently.
Last year, October last year.
And now you have 10 branches.
Yeah.
Yeah, well, business must be good.
It is, because
Big demand.
there's a lot of people suffering from these conditions, di ba? Unfortunately. And
Doc, we'll have a pause for a break, but when we return, we'll talk more about the difference in approach of what you guys do in your clinic vis-a-vis what other people are doing, and we're going to meet two of your PTs who have gone through the traditional route here in the Philippines. We're going to find out their experience as well, and how you guys can help people, suffering from all these motor dysfunctions.
sige.
So guys, more of moving forward with PT when Philippines Uncut returns.
Corrected.
Physical therapy encompasses various tools such as functional movement screens, corrective movement patterns, and actual range of motion, strength, and flexibility assessments.
Physical therapy usually involves some sort of manual treatment techniques, whether it's soft tissue mobilizations or joint mobilizations, or trigger point releases, or any other kind of manual technique. And that's usually paired with some sort of corrective exercise.
Which as an overall outcome will improve their functional activities of daily living.
Corrections in the body that's going to then carry over and have the patient move the right way.
Throughout the years, the misconception of
This program is rated PG. It contains themes and scenes which may not be suitable for very young audiences. Parental guidance is advised.
Be advised that the views and opinions of the hosts and guests do not reflect those of the station.
hot pack on them, setting them up for 15, 20 minutes, putting them on an arm.
Gentlemen, welcome to Philippines Uncut. I'm your host, Buddy Kunanan. Now, in this show, we talk about everything under the sun. And tonight is one's about health, specifically a medical discipline that helps people with physical disabilities and movement dysfunction. And the examples of these are stroke victims, injured athletes, people dealing with chronic pain, and people who've been involved in accidents. Now, joining me to talk about this very interesting topic is Dr. Ronald Samaniego, and he's Doctor of Physical Therapy. Dr. Ron, welcome to Philippines Uncut.
Thank you. Thanks for having me here.
And a pleasure to have you, actually, Doc, because, PT, physical therapy, or PT.
Of physical therapy under the supervision of a doctor is that it is just a manipulated wellness exercise program where they could do it at home. What the truth is that true physical therapy should be a course of hands-on manipulations, range of motion, and will be based on treatment plan.
The first thing that they should expect is to learn a lot about their body and how they're moving and why their problems are occurring. Sometimes people are surprised by what it really is that's causing their pain. Good physical therapy should stress how to make changes in the person's life so that these problems not only go away right now, but they go away forever.
We're not just putting a Physical therapy is a tool in the healthcare field utilized to find impairments and disabilities in the individual.
Through physical therapy, we can evaluate and find out what's causing a lot of these impairments. It's our job to figure out how to correct